A very good morning to Mr. Ko. I'm Tanusha and this is Kai and that's Kavi. We are from DKHP Semester 2 Batch 2019-2020. Today we'll be presenting on a topic known as health communication via social media, effective or not. In this era of information and communication technology, every sector is taking advantage of social medias and healthcare is no exception. We are not only obtaining information via websites, but we also interact through various types of social media such as Facebook, Instagram, and Twitter, and also many more. Healthcare has now become patient-centered, which makes patients their top priority. Hence, the need to implement a social media strategy. Therefore, healthcare communication via social media is definitely an effective way of engaging with public. One of the benefits of healthcare communication via social media is increasing the interaction between health professionals and general public. Social media brings a new dimension to healthcare as it offers a medium to be used by the public to communicate with healthcare professionals. And with the possibility of potential improving health outcomes, social media is a powerful tool. Social media offers collaboration between users and it's a social interactive mechanism for a range of individuals. Although there are several benefits to the use of social media in communication with healthcare, the information exchange needs to be monitored for quality and reliability purposes. And also the user's information should be kept confidential and privacy needs to be maintained. Examples of these recommendations include the need to determine the relative effectiveness of different types of social media for health communication using randomized control trials, and also to explore potential mechanisms for monitoring and enhancing the quality and reliability of health communication using social media. The next point will be presented by Kai.
Okay, my point is public health monitoring. Okay, so public health monitoring is some people use hashtags such as flu, so they can reveal when the disease pop up in the certain area or location. So the public health organization can sense the variety of symptoms, so they can prevent or cure the flu or something. And then is official healthcare social media channels can also provide the real-time health information. For example, look at the Center of Disease Center tweet during a flu season. They share updates on flu activity across the United States and encourage people to get the flu shot. So next I will pass to Kavi.
Okay, so for my point, my point is citizen engagement. So as you can see, healthcare issues can seem to be very tricky. For example, the most sensitive healthcare issues are sexual life, cancer, STD, long-term diseases, depression and anxiety. So as for me, I will be talking about sexual life and also STD. So doctors think that patients mostly think that private life and sexual life are embarrassing, and it is embarrassing and people tend to not talk about this. But this is where this issue comes. This can get in the way of a very effective healthcare. For example, American Sexual Health Association, ASHA, has done a research and has proven that only 12% of young people has said to be tested with sexually transmitted disease, also known as STD, in the last year. But there are actually more people out there with STD which is not tested, because as you can see, people are embarrassed to be testing STD because they do not want the public to know that they're having STD, because they consider that as their private life and they feel embarrassed when the public gets to know that they have STD. But this is where ASHA plays a very important role. They create campaigns, they create videos and everything to show the public that they do not have anything to be ashamed of, because being tested for STD is a normal thing. That just because you are getting tested and the result is positive, there's nothing to be ashamed of, because it doesn't mean that you are having a very active sexual life, because STD could even be transmitted to blood and stuff like that. So to prove my point, I'm going to say that social media is a very effective place to communicate through healthcare, because this would help the youth to be more confident and less embarrassed about health lives. So, in conclusion, I believe that health communication through media is very effective in educating the public, because this helps the public to be more aware of the types of health issues that are affecting the country. For example, like the recent coronavirus and everything like that. And this will also help the youth to understand more on how to treasure their health and understand their body better, because through all this testing, they could know that how they could take care of the body. That's all from me and my teammates today. So thank you.
Thank you.